Hello everyone, I'm Dr. Skerdi Faria, founder of Keit Hospital. Today I'd like to focus on a very concrete aspect of aesthetic medicine and surgery which doesn't directly concern the outward appearance but rather the way the mind experiences the surgical journey, anxiety before and after the procedure. In clinical practice, surgical anxiety doesn't always manifest as an explicit fear. It's often silent, hidden behind the patient's rationality, information and determination. A person can be convinced of their choice, have understood the surgical procedure and have reasonable expectations, and yet feel an internal tension that they can't quite explain. This happens because surgery, especially when it's aesthetic, involves not only the body but also the perception of control. Before the procedure, anxiety is often linked to the loss of this control. The patient entrusts their body to a process that they do not directly govern. Even when trust in the doctor is complete, the mind continues to project scenarios. How will I wake up? How will I look? How will others react? What will happen if something doesn't go according to plan? This type of anxiety isn't irrational. It's a human response to uncertainty. In aesthetic medicine and surgery, preoperative anxiety often manifests through the need for absolute certainty. The patient asks for guarantees, wants to know every detail, tries to predict every possibility. But surgery doesn't work on absolute guarantees. It works on probability, experience, and attention. When the mind demands total certainty where it cannot exist, anxiety increases. After the procedure, the dynamics of anxiety change. Uncertainty is no longer about what will happen, but what is happening. The body is in the healing phase, and the appearance is temporary and changes from day to day. Swelling, bruising, temporary asymmetries, and unusual sensations are a normal part of the healing process, but for a mind under tension, they can be experienced as warning signs. In this phase, post-operative anxiety is often accompanied by excessive self-observation. The patient analyzes their face or body continuously, looks for differences from one day to the next, and attributes meaning to every single detail. This isn't a sign of aesthetic dissatisfaction, but an attempt to regain the sense of control over the situation. A peculiar element in aesthetic medicine and surgery is the fact that anxiety can temporarily distort perception. The result can be technically correct and consistent with the surgical plan, but the mind is not yet ready to process the change. In this phase, the patient may feel insecure, restless, and indecisive, even in the absence of any objective problem. It's important to understand that post-operative anxiety isn't necessarily a sign that the surgery was done incorrectly. It often indicates that the mind and body are not yet in the same phase. The body has begun to heal, while the mind is still in a state of anticipation and tension. In this context, the doctor's role in aesthetic medicine and surgery is fundamental, not only to monitor physical healing, but to guide the patient through this transition phase. A clear explanation of what is normal, the pace of healing, and the actual timing of results helps to reduce anxiety and restore confidence in the process. There are also situations where anxiety is so pronounced that it makes a pause before the procedure necessary. This doesn't mean the patient isn't suitable, but that the timing isn't right. In aesthetic medicine and surgery, the choice of timing is just as important as the choice of technique. An overloaded mind risks never experiencing the result in a healthy way. An often overlooked aspect is that anxiety is also fueled by an incorrect pace of expectation. The patient may expect an immediate change, while healing is a process that happens in stages. When you expect the final result in the very first days, every swelling and every temporary change becomes a source of concern. For this reason, defining a realistic healing schedule with clear milestones significantly reduces tension and makes the post-operative period more manageable. Equally important is the way in which the patient seeks reassurance after the procedure. Some people seek security by asking continuous questions, taking photos non-stop, comparing themselves with others, or relying on the opinions of those around them. However, this reassurance is short-lived, and the doubt returns. A healthier approach is to maintain regular and structured communication with the medical team based on clinical checkups rather than daily comparisons. It should be emphasized that anxiety before and after surgery isn't managed just with reassuring words. It's managed with planning, clarity, and constant support. When the patient knows what to expect, understands which signs are normal, and feels they have clear guidance at every stage, the mind reduces tension and allows the body to heal. This is why post-operative care is not just a technical checkup. It's an integral part of the experience of the result. Another very practical element is that anxiety increases when the patient experiences the healing period in isolation. When there's no routine and the day is filled only with observation and waiting, the mind amplifies every sensation and every detail. For this reason, while following medical instructions, it's helpful for the patient to maintain a simple daily rhythm, adequate rest, regular meal, light movement when permitted, and moderate activity that distracts the mind from constantly checking their appearance. This reduces tension and makes the healing process more serene. In conclusion, anxiety before and after surgery is a real part of the aesthetic journey and deserves to be recognized and treated with seriousness. In aesthetic medicine and surgery, success is not determined only by the visible result, but also by the way in which the patient experiences the change. When the mind is guided, informed, and supported, the surgery has better chances of offering not only a physical improvement, but also inner calm and long-term well-being. Thank you for listening.